Hi, ladies and gentlemen. It's Dr. Novoa, and this is my wife, Danielle.
Hi, everyone.
Novoa. So we'll give a few minutes for everybody to sign on. Let us know if you can't hear us very well or if you hear any static, because we're currently on microphones, and we'll be glad to turn them off to go to regular recording.
I'm trying to share it to the pages, your pages.
Give us a few minutes. We're sharing to our other website pages or the Facebook pages. Just in case, we are at home right now, and my mother-in-law is babysitting our son. So if you hear any screaming, it's him.
And if I have to walk away for a minute, don't. Yeah. Please. Hope you don't mind. I just shared it to drnovoa.com.
That's fine. Feel free. This is a public forum, so feel free to share it to the other pages on Facebook, such as Essure Problems, PTLS, the Breast Cancer Awareness.
Essure Problem.
I did say Essure Problems.
Yeah, I'm posting it.
Okay. Okay, so my name is Dr. Novoa. Many of you have followed Danielle and I for more than a year when we do our Facebook Live pages. And what we're trying to do is, first of all, I'll give you a little bit of background. I am an OBGYN and a cosmetic surgeon. So I've been doing both for more than 20 years. I've been managing care of patients with foreign body reactions for over 10 years now, and specifically issues with breast implants, with meshes, vaginal meshes, urethral meshes, and also with the Essure permanent sterilization device. In that realm, we've been also dealing with the issues of doctors not being able to, not in any way really discussing these particular foreign body reactions with patients and dismissing their concerns. And this is our main issue here, is to try to have patients have an understanding of what's going on as far as doctors are concerned, because doctors are just like everyone else. Although we do have more experience and education in certain subjects, foreign body reactions are basically a new realm of understanding, which makes it very difficult for some doctors to get out of the idea that, hey, listen, a patient that suffers from vaginal bleeding can't possibly have cognitive changes or memory lapses or 30 pounds of weight gain. This instrument is not causing these foreign body reactions. And in reality, they absolutely are. So the first thing we want to do is have a few statements of fact. Number one, all implants are foreign bodies, and therefore all implants are capable of causing foreign body reactions. That's what you have to write down, and that's what you have to absolutely understand, and what the message has to get out to all doctors. All implants cause foreign body reactions. And because of that, the severity of the foreign body reaction is unique to each patient. Some patients don't have any symptoms whatsoever, and some patients almost immediately after you put in the implant start to suffer from these very strange, very weird to them, but very real foreign body reactions, such as problems with chronic headaches, migraine headaches, cognitive changes, brain fog, concerns such as like Alzheimer's symptoms. They have excessive weight gain for the Essure device, the Essure belly. Then the autoimmune symptoms that are similar to lupus, the chronic fatigue syndrome, chronic pain syndrome. As far as breast implants are concerned, we're looking at the breast implant disease or illness, and most frequently the issues related to the association of textured implants to breast implant associated anaplastic lymphoma, and I'll get the rest of that in a minute. anaplastic large cell lymphoma. The acronym has kind of escaped me for a moment. As far as Essure, obviously we know what's going on with Essure and the foreign body reactions that it causes. But let's talk about for a moment Filshie clips, Hulka clips, elastic bands. All of those are, or any permanent sutures that are used, all of those are associated with foreign body reactions as well. So women that are suffering from post-tubal ligation syndrome have an increased risk of having a foreign body reaction associated with the instruments or the devices that were used to occlude the fallopian tubes. That includes the Essure device itself. The Mirena IUD, the Paragard IUD, all of them are foreign bodies and therefore can cause significant foreign body reactions to some women. The vaginal meshes, the urethral meshes, the abdominal hernia meshes, all of these meshes are polyester devices. All of them are basically the similar in what they can do to the tissue around them. All of them are associated with foreign body reactions.
Someone's asking if that includes like stents for like
vascular stents. All of these devices are capable of causing foreign body reactions and do cause foreign body reactions. So where is the logic escaping us? And what I want people to understand is take a moment, take some paper, write this information down. I am not the first doctor to have talked about this. I'm not even the expert in the field of talking about this. But what I can tell you is that I am one of the doctors that is crossing over and understanding outside of my own specialty what is happening when we put foreign bodies inside of the body. Who are the experts related to foreign bodies? They're going to be the biomedical engineers that create the implants. And then you're going to talk about the immunologist. Now, you have two different types of immunologists. You're going to have the academic immunologist. They're the ones that study these foreign bodies on an academic level. We're looking at in mice, in animals, or even taking the devices and then studying them on a cellular level. These are the academic immunologists. The clinical immunologists are the doctors that are going to be managing your care when you have an issue related to a foreign body reaction, along with the rheumatologist. So these are the true experts related to this. But those experts are not talking to the clinical doctors, such as the gynecologist, the urologist, the primary care doctors. They're not talking even to the psychologist or the psychiatrist or the general surgeon. So we're missing a mark here, where we're taking all of the information that we've learned or that we see as point of fact from the FDA, and we already know that the FDA is critically compromised as far as how it does its studies and how it pulls how it does its studies to get an implant on approved, then how it manages the post-marketing evaluations, and how it ends up pulling an implant off the market afterwards if there's a problem with it. So we look to the FDA to give us answers, and the FDA is critically compromised. And therefore, what ends up happening are years and years of suffering, pain and suffering on the part of women, mostly in what I'm talking about, but also happens to men who happen to have implants. And it takes years or even decades and thousands or hundreds of thousands of women suffering before the FDA will finally start doing any evaluation. And even then, it gives anywhere between 5 and 10 years of continued research in determining whether or not an instrument or an implant should come off the market. A perfect example right now is what's going on with breast implants, with specifically textured implants, which have been associated with the ALCL. And if you're not aware, the best studies that were done with breast implants and that particular type of lymphoma was done in Australia and New Zealand, and that was actually done a couple years ago. But it's taken 2 years before Europe has finally done something about it, and France demanded information from Allergy for its BioCell breast implants, and because it didn't get it, the French banned the use of textured implants in Europe, and because Europe is a part of the European Union, it basically was banned in all of Europe. Now, as of just last week, Canada has pulled textured implants off of the market. At the same time, the FDA is saying there's not enough information available on textured implants to pull these devices off the market. This is with a significant amount of information from the Australian and New Zealand studies suggesting that textured implants have a very, very high rate of association to lymphoma, which is a particular type of cancer. And yet the FDA has not even done a moratorium on textured implants and continues to allow them to be sold here in the United States, but in most of the other countries, including Canada and European Union, they have been pulled because of this associated risk. Now that's just talking about breast implants. Let's talk about Essure. And I highly recommend that if you have the opportunity to go on Netflix and watch the movie The Bleeding Edge, which talks about the corrupt nature of the FDA, the issues related to the doctor-physician relationship, and the lack of information and lack of follow-up, lack of care when it has to do with a variety of different implants. So again, you don't have to go with my message. I want you to take the time to look this up. Look at the documentary, The Bleeding Edge. Go to the other Facebook social forums, such as Essure Problems Forum. You can, as an individual and as a group, change the way manufacturers deal with their implants. And in the case of Essure, for example, it's no longer available anywhere in the world. And that was a concerted effort of more than almost 10 years of effort on the part of, specifically started from a social media forum of the Essure Problems Forum, to get a device that was associated with hurting women, get it off the market. The next step will be probably to get textured implants off the market in the United States. Now, this is not associated, the breast implant problem of lymphoma is not specifically associated with smooth implants, but because breast implants are a foreign body, you have to understand that breast implants are associated with foreign body reactions. Specifically, and the most common is capsular contracture. That is a hardening or an allergic reaction, a sensitivity reaction to the implants, which occur in up to 1 in 4 women will have a complication with her breast implants, which would require additional surgery. Your doctors don't tell you that. They should tell you that. That is part of the informed consent. And breast illness, breast implant illness is a foreign body reaction, which I'm trying to get around to and put it all together in a unified understanding of what's happening. So Essure device causes a foreign body reaction, both localized and systemic. Breast implants, foreign body reaction, both localized and systemic. The Filshie clips, which is also metallic component, localized and systemic, also associated with post-tubal ligation syndrome. The vaginal meshes, localized and systemic reactions. Abdominal meshes, the same deal. So all of these devices, all of these implants, vascular stents, the same thing, localized and foreign body reactions. All of these can be umbrellaed under one particular syndrome, and that is called the autoimmune inflammatory syndrome induced by adjuvants. The acronym is ASIA, and that was first published by Dr. Seinfeld. I had it. Schoenfeld. Yeah, Schoenfeld from Israel. I'm thinking of another person in 2009. Now, that incorporated 5 different syndromes trying to understand how foreign body reactions occurred. And Dr. Schoenfeld's research, along with his colleagues, published what's called the autoimmune inflammatory syndrome induced by adjuvants, or ASIA. And that's what I'm going to say from now on is what is ASIA. Under ASIA, every single type of implant falls under ASIA. So umbrella it under ASIA, and now you have the foreign bodies. Now they can either be metallic in component or non-metallic in component, and each one is associated with a different response, but overall, both localized at the site of insertion and systemic, where it's causing foreign body reactions to appear, such as a lupus or chronic fatigue syndrome, fibromyalgia, any list of hypothyroidism, diabetes, all of those fall under the systemic response. So I posted along when I posted it yesterday, or the day before yesterday, a little chart, and I want you guys to go to that particular chart to try to understand how Asia works. So if you have a metallic adjuvant, such as Essure, which is made out of nickel, another thing you need to write down, please go to the FDA. The FDA recently in April, or it was in March, published a recommendation related to the management nicotol devices or implants. That is a combination of nickel and titanium implants. Now, most doctors don't know anything about this, but you can find it if you Google and go to the FDA, or if you do FDA, NITINOL, nicotol implants and their recommendations. What they're saying is that for any device that has this type of component, a metallic component, if there's not a basic need for it to be placed, it should be removed, especially if the patient has some type of symptomatology related to it. So all of the doctors that are telling you that there's no reason to remove this device, even though you're going in there with chronic migraine headaches, fibromyalgia, chronic fatigue syndrome, all of these different syndromes, your doctor basically doesn't know what he's talking about, okay? And he should do the research on this, because it's not just about nicotol. It's talking about every type of implant. So that's just one little part, and we could spend hours on this. And basically what I'm trying to do is give you guys an opportunity to look this up and write your own notes and get a better understanding for yourself of why it's not all in your head, why we're the ones that are making the mistakes, why the doctors are the ones that are wrong in this scenario, and they're not doing their research, and they're basically wrong and dismissing you, not following up with your care, and basically not referring you to someone that actually knows what they're talking about. So one key component related to nicotol implants are nickel leaching. That means that in the component, the implant itself, nickel will leach out of that implant and go systemic. And once it goes systemic, you have the whole body reaction of dermatitis, so the rashes that are associated with it, and it also causes these other symptoms that are related to it. And this is already documented by the FDA. So when a doctor dismisses your complaints, ask them, or basically I wouldn't throw it in their face, but just give them a copy of the nicotol draft recommendations from the FDA and ask them, well, what's your opinion on this, doctor? Since obviously I don't know what I'm talking about. You tell me that, since you've already read up on this, because I'm paying you $100 to $150 to sit here and get your advice, and you basically don't know what you're talking about. Okay, that's the key there. In the non-metallic adjuvants, we're talking about the polyester meshes, abdominal meshes, vaginal meshes, urethral meshes. They're all made out of the similar component called polyester. Polyester fibers, depending on their structure, can cause a relatively benign foreign body reaction or a severe foreign body reaction. Benign foreign body reactions, such as those that are used in vaginal stents, because you don't want to have a hypersensitive reaction around vessels. And an intentional severe foreign body reaction in the case of the Essure device. And so that's non-metallic adjuvants. Now, when you get an understanding of what, if I didn't explain what an adjuvant is, it's basically something that stimulates a particular response. And in this particular case, an autoimmune response. So the key that I wanted to suggest related to, for example, the Essure device, as we have the most information on right now, is the fact that the localized response to it is the scarring of the fallopian tubes around the Essure device. The same thing can be said of vaginal meshes, urethral meshes, and abdominal hernia meshes, but not to the extent of Essure. Nevertheless, it does cause those local reactions to them. Inflammatory response, chronic pain, sensitivity, granulation or firmness around the mesh itself. These are localized foreign body reactions to the particular polyester mesh. Now, as far as systemic, now let's take Essure, but you can just piggyback that on all of the other types of polyester meshes. Essure is also has a component of polyester called the PET fibers. They're polyethylene fibers. Now, chronic systemic effects are associated with, the cognitive memory changes, Alzheimer-like memory loss, depression. Systemic nickel allergy syndrome is specifically associated with nickel and therefore also part of the chronic systemic effect, also part of Asia under that big umbrella. So we're looking at hair loss, dental caries, systemic contact dermatitis, gastrointestinal symptoms similar to irritable bowel syndrome, Crohn's disease, and ulcerative colitis, excessive weight gain with lymphedema, and this is what's key. Unfortunately, women, because they're female and as they get older, have a predisposition to suffer from autoimmune diseases such as hypothyroidism, diabetes, chronic fatigue syndrome, fibromyalgia, and thyroid problems, for example. Under that, we're looking at if you have an implant and you already are predisposed to a foreign body reaction or autoimmune disease, the implant can make your condition worse. So for those patients that all of a sudden are starting to have signs of fibromyalgia, for example, chronic fatigue syndrome, a worsening of underlying diabetes, hypothyroidism or hyperthyroidism, the implant may be triggering a worsening foreign body reaction or maybe inducing a similar reaction that's not being diagnosed by your doctors. And so this is exceptionally important to understand that the implant itself may be causing the symptoms or worsening the symptoms that you already are predisposed to. And this is why the implant should be considered to be removed in patients that suffer from this particular condition or autoimmune condition. Now, how do we know that it's beneficial? For the doctors, for example, that are removing vaginal meshes, urethral meshes, Essure devices, Filshie clips, elastic bands, what we're seeing is that patients that are suffering from symptoms that are similar to to systemic autoimmune diseases seem to improve within 24 hours of the removal of the implant. And we're looking at this happening in about 90% of patients that have an implant removed. Notice that their symptoms are starting to improve. Now, this is significant to what we see. And the fact of the matter is, the reason why your doctors are not telling you about this is because there are no studies, long-term studies that are addressing this. This is information that's passed on from doctors that are doing these removals individually. And we are talking to one another, but you're only talking about 1% of doctors that are removing these devices and 1% of doctors that are talking about it. So we need to get all of the other doctors on board, and how we get that to happen is from a push from the patients to say, hey, listen, it's not in my head. I want you to help me, or give me someone that will help me. And this is the key to understanding what we're talking about there. Now, let's talk about some specifics. And again, I'm going to rush through a lot. Breast implants. If you have a capsular contracture and you're having symptoms of fatigue, loss of hair, excessive weight gain, fibromyalgia, you should consider having the breast implant removed. If the same thing is occurring with the Essure device, the same thing applies. Filshie clips, same thing applies. All of these different devices, if it's possible, you should consider having them removed for at least to reduce the effect that they may have on the foreign body reaction that you're already, or the autoimmune response or a disease that you already have. Again, I could talk about 1,000 different things, some key things. Please, if you're having the device removed, please try to have everything associated with the device removed. I know that there are plenty of doctors out there that are only removing, for example, the Essure device. They're only removing the device and they're leaving the fallopian tube behind. We're calculating that about 10 to 20% of cases, a doctor is leaving a piece of the Essure device behind because they're not doing the pre-op correctly. They're assuming that that it won't snap. It will snap. They're not checking to see how far into the uterus the Essure device is. In the case of implants, breast implants, it is recommended if you're having a foreign body reaction, you should have the entire capsule removed. It's called a capsulectomy. If you're talking about vaginal meshes, they're extremely difficult to remove, but you should try to remove the entire vaginal mesh if possible. If you're talking about Filshie clips, Hulka clips, elastic bands, you should try to remove the entire portion associated with that particular defect. And unfortunately, for right now, related to post-tubal ligation syndrome, a majority of doctors are removing the entire fallopian tube as part of a tubal ligation now. And so the idea of a reversal is becoming less and less of an option for a lot of women. The key to all of this is what we call informed consent. Your doctor should carefully and extensively discuss all of the possibilities related to a procedure that is done, and obviously the foreign body reaction associated with all of these particular devices. So that's my spiel for right now. Any questions?
One was, is it possible to cause bone infection?
Osteomyelitis, yes, especially if the implant itself is in a relatively close area to the lymph nodes. Now, this is individual cases. There are no studies, as I said, with all of the other devices. There are no long-term or even short-term studies comparing one particular condition to another. But in particular, the loss of vitamin D and issues with salivary problems and that is which are in a syndrome associated with that can cause dental problems, and therefore dental or maxillary infections are not unusual. This is something that you should discuss with a rheumatologist as well as your the orthopod or the specialist in that particular field.
I asked if anybody had any questions, so let's give them a minute or two.
Okay, so are there any questions? Feel free to ask now. Danielle's looking at the laptop for me.
Yeah, so we can see here too. Right there. Those are, they would ask questions there.
Okay.
Someone put thank you.
You're welcome.
I guess no one has any questions.
No questions?
You probably covered everything.
Okay. So if you could do me the favor, if you could take the time if you're trying to understand what's going on with your implants, please look up
one question, sorry.
The syndrome of Asia. That is pretty much going to umbrella everything that you may think is happening and why it's happening. I can almost guarantee, unless your doctor is a rheumatologist, an immunologist, your OBGYN has never even heard of this syndrome before.
Questions are coming in. Are side effects post-removal of Essure lifelong? And my vitamin D was very low. Is that from Essure?
We can't give you a specific answer to whether or not the condition is lifelong. What we've noticed is that between 24 hours and 3 weeks after the removal of an implant, like Essure, 90% of patients show a significant improvement or complete reversal. Why is it that 10% still have problems, or 10% notice that there's been no change? There's going to be about a 10% baseline of women that were predisposed to have autoimmune disease. And whether or not Essure triggered that or made it worse, we just don't know. But I wish we could say that it's 100%, but unfortunately, we can say that it's only about 90% to show significant improvement, and we consider that to be lifelong.
Can Mirena cause low vitamin D?
Mirena, there's nothing that we've seen that Mirena causes that, but Mirena is a foreign body, and therefore you have to keep in mind that that Mirena as a foreign body is an issue that should be evaluated. Also, if you're not aware, Mirena has a black box warning on it, and you need to be aware of that particular black box warning. And Mirena is associated with a number of lawsuits associated with intracranial hypertension, and it can cause, if you do have intracranial hypertension, it is associated with temporary or permanent blindness. So okay. I'm sure you never heard of that one before.
How much of a fallopian tube should be taken with Essure? Just past coil or entire thing?
If you're attempting a reversal, you should try to preserve as much of the fallopian tube as possible. Generally, the fallopian tube is approximately 7 centimeters in length. In order to do a proper reversal, you have to preserve as much of that tube as you can. The absolute expert on that particular question is going to be Dr. Charles Monteith in North Carolina at Chapel Hill. He is the leading expert on Essure reversal Essure removal and fallopian tube reversal. And for those that are also suffering from post-tubal ligation syndrome or have another type of occlusion of tubal ligation, Dr. Charles Monteith in North Carolina, Chapel Hill, is the expert in reversal of tubal ligations, including Essure, obviously.
If you have a hysterectomy with leaving the ovaries, what effect does it have on polycystic ovaries? Also, how do you know what's going on with them after you have no menstrual?
Okay. It's very interesting what happens when you manipulate a fallopian tube, whether or not it's with any standard laparoscopic surgery, or whether or not it's with a tubal ligation, or whether or not it's with removal of an ovary for an ovarian cyst, or with a hysterectomy. In approximately 5 to 15% of patients that have any type of surgery that is nearby to the ovary or to the fallopian tube, there is going to be either a transient or a permanent change in the hormonal effects of the ovary. Not even on that side, it can be on the opposite side. So if you remove an ovary, if you do a tubal ligation, it's possible that you can have a temporary or permanent ovarian failure of one or both ovaries. The hormonal changes after that are also possible with polycystic ovarian syndrome, although not specifically associated with the surgery, because you can still have polycystic ovarian syndrome without any type of surgery. We don't know specifically what causes it. We just know that it does happen. And so patients that suffer from symptoms other than menstruation, obviously, because you don't have your uterus anymore, should specifically pelvic pain or weight gain, then an ultrasound of the ovaries is generally recommended. Although if you're going to be working them up for polycystic ovarian syndrome, you're going to be doing hormone tests for thyroid, the follicle stimulating hormone, the luteinizing hormone, estradiol, insulin, hemoglobin A1C, and then of course sit down and an ultrasound. And then you're going to evaluate the polycystic ovarian syndrome components of that. And then if possible, a lot of times low-dose birth control pills may offset the issues with polycystic ovarian syndrome, and the use of metformin or medication like that, which is very helpful for PCOS.
We have more questions coming in. Does Asia affect breathing? Is there a safer method of sterilization to avoid Asia and PTLS?
Absolutely. The safest method of permanent sterilization is the male vasectomy. Again, I'm an OBGYN. I do tubal ligations all the time, and I'm going to tell you 1,000 times, the best and safest, most effective way of permanent sterilization is the male vasectomy. There are very, very few cases where a male cannot get a sterilization, a vasectomy, and because of a medical reason. Almost always is going to be because he doesn't want to, or it's not affordable. I absolutely understand if it's not affordable, but the fact that a man does not want to get a vasectomy and obligates his partner or his wife to have the tubal ligation is basically inappropriate or irresponsible of that man. I can tell you from personal experience, I got a vasectomy awake, and I was back at work a couple hours later. Now, I had it reversed. Obviously, it was a much more difficult and uncomfortable situation, obviously because there's one running around back here. Mm-hmm. But the fact of the matter is, I'm speaking from experience. So in order to avoid the issues of Asia and to avoid the issues of post-tubal ligation syndrome, the OBGYN, the primary care doctor, should always stress and always recommend that the male get the vasectomy first.
I had just the tubes removed with the Da Vinci. I feel immediate relief. My question is, why am I having severe lower back pain now?
That I can't answer for you. I'm obviously, I have a personal issue with Da Vinci. I've done almost 2,000 tubal ligations laparoscopically. So I've done them with the cameras. two ports of entry, one through the belly button, which is 5 millimeters, and one in the pubic hairline, which is also 5 millimeters. 5 millimeters is about the size of a pencil. That's how far around it is. With Da Vinci, unless you're talking about a true expert, which first of all, I wouldn't understand why they would need Da Vinci anyway, but if you're going to do a single port in the middle, in the belly button, then that's explainable or understandable. If you're putting 4 or 5 port sites by Da Vinci to do a tubal ligation, that's overkill, that's excessive, that's unnecessary as far as I'm concerned, especially for port sites that are way to the left or way to the right, because patients suffer from excruciating pain for weeks later from their incisions. Now, if you're having back pain, you have to address how long did the procedure take, because normally with traditional laparoscopic procedure, a tubal ligation should only take you approximately 10 minutes to do. If you get your operative report and you look and see how long it took to do the Da Vinci tubal ligation, and you were on the table for more than an hour and a half, it could be that it was positional that caused the lower back pain. And then my recommendation would say to go see a chiropractor or massage therapist and see whether or not that might relieve some of the discomfort that you're still feeling.
Someone has a question, but I don't know. Paulette is asking if you can get ovarian cancer from Essure.
There's no evidence to suggest that Essure is associated with ovarian cancer. What we are aware is that the fallopian tube, in an estimated 50% of cases, the middle to the end of the fallopian tube is associated with a transmission of cells that leads to ovarian cancer. And so if you have is that you? Sorry.
That's not me.
No, it's me. So if you have an inflammatory response that's pushing these cells to the end of the fallopian tube or isolating them to the end of the fallopian tube, then the risk of ovarian cancer does go up. Now, that is an extremely low risk to begin with. It's estimated to, the statistics read at this. If we were doing 400,000 tubal ligations a year, the prophylactic removal of the entire fallopian tube is saving about 1,000 women from developing ovarian cancer per year. Now, that seems significant, but in reality, you have to do 400,000 tubal ligations to preserve that, to get that risk reduced. And so, to answer your question again, we don't have the answer to that, but I can tell you that the middle to the end of the fallopian tube is associated with an increased risk of ovarian cancer, and that is why a lot of doctors now, for a tubal ligation and recommended by ACOG now, the American College of Obstetricians and Gynecologists, is recommending that women that have tubal ligations have the entire fallopian tube removed. It's called a salpingectomy. So for all of the ladies that are concerned about post-tubal ligation and reversal, this is another key thing to discuss with your doctors, because a lot of doctors are no longer leaving the fallopian tube behind. It becomes an absolute permanent and irreversible procedure. And the reason that we're justifying to remove the entire tube during a tubal ligation is to reduce the risk of ovarian cancer.
We have a lot of questions coming in. I don't know if you answered this one earlier, but she's asking again. Does Asia affect breathing?
I can't answer the question about Asia affecting breathing, but I can tell you that any issue, heart palpitations, we do know costochondritis and inflammatory reactions, muscle spasms are associated with foreign body reactions. So whether or not it's causing a shortness of breath, I can't answer that question, but it is a possibility.
I think she asked this earlier too. How to distinguish PTLS versus Asia?
This is where it's very interesting. And again, if you don't mind doing the research, I was trying to understand if PTLS could be a form of Asia. And the information that I found was very interesting, but it's from the 1990s. What they did in the 1990s was evaluate post-tubal what happens to the fallopian tubes as a response to the tubal ligation. And what they found was that inflammatory cells, which include plasma cells and antibodies of IgA increase after the tubal ligation. Now, we also know that these same types of cells increase with in Asia. And so if you're looking for Asia, we're looking at the anti-nuclear antibody screen, the rheumatic factor, Rho SSA, La SSB. And again, I wish that it was easier to kind of throw this at you, and lupus panel. If you do these particular tests, you might notice a difference between PTLS and also Asia. An interesting thing also, based on what I was reading, is that shortly after delivery, all antibodies of the IgA, IgM, and IgG significantly increase right after delivery. These are the antibodies for immune reactions. Now, if you get your tubes tied right after you deliver, you might be at higher risk of developing PTLS. It might be better to wait 6 weeks after you have the delivery and then have it done by a laparoscopic procedure where there is fulguration, a burning of the tubes, rather than putting on a Filshie clip, Hulka clip, or celastic band, or even tying them. Fulguration, or burning of the tubes, destroys the tissue around it, and therefore the inflammatory response is less likely.
So if the method of 4 to 5 ports with Da Vinci isn't recommended, what is the best way for Essure removal via hysterectomy?
Again, the preference to removal of the Essure device is based on the comfort level of the doctor and not on the device that's used. For example, I remove Essure laparoscopically by the use of only 3 port sites, all 5 millimeters in size, and I remove once I release the fallopian tubes, I remove everything from below vaginally. Da Vinci, especially if you're doing a subtotal or a total laparoscopic hysterectomy, Da Vinci requires the 5 ports. 2 of them are almost 12 millimeters big. It's twice the size of a pencil wide, and that requires the 5 ports. So it's not a matter that Da Vinci's better. It is simply of what the comfort level is of the doctor doing the procedure.
Is it possible after removal of Essure to still have costochondritis, systemic inflammation, and heart palpitations, just to name a few symptoms?
Yes, and again, I believe that there's still probably a triggered autoimmune response going on. The rheumatologist and hematologist and allergist should be consulted, especially if the uterus is left behind or the fallopian tubes are left behind, because I'm still under the impression that the inflammatory response is still present even though the coil was removed. Now, there is no study for that specifically, but that's my impression. You want to turn on the fan?
Do we know if there's a genetic predisposition to Asia PTLS, such as MTHFR, or are we all risk for Asia just because a device is used?
MTHFR, it is a genetic mutation, but unfortunately, I have not seen nor have I read anything significant to suggest that it's specifically associated or makes an autoimmune reaction worse. Sorry, the dogs. So to answer your question, just because you have that genetic mutation does not put you at a higher risk of having other issues or autoimmune reactions or autoimmune syndromes. I know that there's a lot of people that think that, but it's a misunderstanding of the actual gene mutation.
I was getting severe muscle contractions on my left side around the ribs that took my breath. Was this possible side effect of Essure?
If you no longer have it, the inflammation and muscle spasms are associated with a variety of different conditions, also chronic pain syndrome and fibromyalgia. So I cannot tell you or give you that answer. I would suggest that if you're suffering from this and there's any way that you can have the Essure device removed and everything else has been eliminated a possibility, you probably will notice that there's improvement after Essure is removed. I know.
Aren't you warm?
A little bit. Can you turn on the fan? Are we good?
Should put yes, they are gone.
They're gone? Okay. What we have to understand, and maybe we come to a conclusion for today, is this. Ladies and gentlemen, this is not in your head. The issues related to your implants and the syndromes associated following surgery are not in your head. What's the problem is that your doctor is focusing in on one particular specialty and having no conceptual understanding of what a foreign body reaction is doing to the rest of your body. Because there are so many specialties of medicine, the doctor literally has to be open-minded and go and do a little bit of research to try to bridge the understanding or what is the cause of one to the other. And when they do that, then they can help you. At minimum, if you're complaining of some other issue not related to GYN, your doctor should refer you to the rheumatologist and immunologist for a better understanding. Could it be a foreign body reaction such as Asia that's causing your symptoms and your problems? The delay in proper management causes severe suffering to women, and the fact of the matter is some women eventually are not able to do anything at all, and they suffer, or we even have cases where women have taken their own life from the fact that they've had a surgery, they've had these implants, and no one's helping them. Our goal is to try to support you in the fact that do your own research, look this stuff up, and then ask for an appointment with a rheumatologist or immunologist or through your primary care, because many times your gynecologist is going to just think that to put it bluntly, think that you're crazy, and obviously you're not. But it's because that your doctor just doesn't know what they're doing, doesn't know what he's talking about. And that's what I'm suggesting that you do. And that's why I wanted to take a few minutes today and throw the term Asia out at you. I'm just a messenger. The message has been there for over 10 years. It's available for you to research. And please do that to get a better understanding and the support that you need from your own doctors.
How do I communicate with an allergist what I need after Essure removed as far as the systemic inflammatory response is concerned?
I would recommend that you talk to the rheumatologist. The allergist is looking at the treatment of a particular foreign body that's still present to the treatment of that, or defined the allergen, where a rheumatologist is more inclined. But the two of them together, this is a multi-specialty management. So I suggest that you talk both to the allergist and to the rheumatologist. Now remember, if you're talking about Essure, under Asia, there is one particular other syndrome called systemic nickel allergy syndrome. So the fact that Essure has nickel in it, which 17% of the population is allergic to nickel or becomes allergic to nickel after it's been placed in the body, that is the syndrome that you should talk to your allergist about. Because even after you have the Essure device removed, you have to modify your diet. You have to limit the amount of nickel that you consume in the fruits that you eat, in the nuts that you eat. Even chocolate has a significant elevated amount of nickel in it. So if you're having allergy symptoms as well as gastrointestinal symptoms, that is possibly under systemic nickel allergy syndrome, which again is under Asia, and therefore the combined multi-specialty management of the allergist and the rheumatologist would be a best bet.
What if you took everything out but your ovaries? Would the inflammatory response be in the ovaries? Because my inflammation became full force after removal.
So I assume that you had your uterus removed, you had the fallopian tubes removed, you had the Essure removed, and the only thing left is the ovaries. I don't believe that the response is localized to the ovaries if the coils have been in the fallopian tubes. But again, ask for thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, estradiol, insulin, even the testosterones, and the ANA, rheumatoid factor, lupus panel, Rho, SSA, La, SSB. They're the fundamental ones you might be wanting to look for and speak to your rheumatologist about.
I can't do.
You're hot?
I'm really
Can you turn on
hot.
the fan?
The fan's not gonna cut it.
Do you want to sit here?
No.
I'm right underneath the...
I'm trying.
My wife is overheating.
It's because I get hot flashes after having a baby.
You want to talk about that?
No. Can you detox after Essure removal with fillings in the teeth? I've heard no.
There is no specific detox program available. I know that there's some patients that think that detoxing via the feet helps out. We haven't found anything that really improves or is a management plan for detox. There are issues related to Essure and causing dental caries. That may actually become worse over time, even if you have Essure removed, because once the teeth become compromised, it's almost like a domino effect. What I do recommend for all patients that have Essure is to see their dentist at least every 3 to 6 months to make sure everything is fine.
They told me to tell you about my hot flashes.
Well, that's HIPAA. That's, you want to talk about it?
Oh, that's HIPAA. You tell them everything else.
No, not about
that's
you.
HIPAA.
Not about you. You want me to talk to him?
Well,
Okay.
what? It's just.
Okay.
What?
You want to explain? I mean, it's...
I don't care. Go ahead
Okay.
if you want to.
Danielle had our son 8 months ago, and since that time, she's been suffering from hot flashes. And
Every night.
Every night. She's...
every night since he was born.
Yeah, she's 29 years old, and has the symptoms of premature ovarian failure. Even though I tested her and looked at her hormones, yes, they were a little low, and we have been trying to figure out from a variety of options, what do we do to try to improve the fact that she's suffering from hot flashes. So we tried with low dose.
Pretty much there's nothing.
Yeah. Well, she's shown some improvement with higher doses birth control pills, but it is something that she is not satisfied with her response. So this is where post-tubal ligation syndrome becomes an issue too, because the problems and symptoms that occur after a delivery may occur to a patient even when they don't have their tubes tied. And yet there is a concern or an association that my symptoms are due to the fact that I got my tubes tied. Perfect example is Danielle. She has hot flashes and symptoms associated with premature ovarian failure, and yet she did not get her tubes tied. Even for us that do believe in post-tubal ligation syndrome, we only estimate that we see it present in between 5 and 10% of patients, and not everyone that gets a tubal. And so we don't have an answer for why it happens, and that's the same thing I'm telling her.
I'm menopausal, that's why.
There he is. You can bring him in. Here's the cause of the hot flashes.
It's okay, Mom. Look at him.
He said, "Daddy, your hour is up."
What's the matter? I heard you screaming over there.
Right? Any other questions?